My name is Géraldine Fauville. I'm an assistant professor at the Department of Education, Communication and Learning at the University of Gothenburg in Sweden. In 2018-2020, I was a postdoctoral researcher at the Virtual Human Interaction Lab at Stanford University. And it's a lab that was founded by Professor Jeremy Billingson, and where researchers looked at augmented reality and virtual reality and looked at the psychological and behavioral impact of this kind of technology.
Hello, this is Dr. Lorenzo Norris, Editor-in-Chief of MD Edge Psychiatry. Today, we are privileged to have Dr. Fauville joining us today on the SiteCast, and we're going to be talking about something that I'm absolutely positively sure that is relevant to many of the listeners, and that would be video conferencing or Zoom fatigue. So I really want you to stay with us because this is going to be an informative SiteCast in which we talk about really what are some of the potential causes of Zoom fatigue and what are some things that we can do to make it a video conferencing a bit more manageable moving forward, because if it's not the new normal, it is the normal. So we want to start to think about this. So please stay tuned to listen to this discussion with myself and Dr. Fauville. Dr. Fauville, welcome to the SiteCast.
Thank you for having me.
Okay. So Dr. Fauville, I got to tell you, when our editors approached me and said, do you want to do a SiteCast on Zoom fatigue? I was like, I absolutely want to do a SiteCast on Zoom fatigue. Not only do I want to do a SiteCast on it, I want to hear more. I want to do a PowerPoint. I want to have a little brief article. I want a tip sheet. I want the whole thing. Because let's face it, at this point in time, we are more past the year mark of this pandemic, depending on where you say that where the pandemic started. Video conferencing, like all of us, for all of us at this point in time, that is the standard. I video everything, and the interesting thing in this COVID dynamic, I find that I'm video conferencing at any point in time at times. Like, it's nothing to have a meeting at like 7:30 at night. People are like, oh, okay. You video conference with your parents. Oh, okay. You video conference with everybody except likely people in your immediate household. And even then, there might be a chance, I'm sure there's some people out there that are Zooming from like one room to the other. That would be a bit interesting. But this has started in my various roles. I've seen folks now, they were already getting tired, but I really felt like folks started to hit a wall in January. They just started to get tired. I mean, and no one could really put their finger on it, but I was talking with a group of psychiatrists and everyone was just exhausted. So I do feel as though a number of factors related to the pandemic, but also just outright exhaustion with constant video conferencing. And I mean, we're saying Zoom fatigue, but it could also, I'm assuming, apply to WebEx or Google Meet or any other video conferencing platform. So Dr. Fauville, can you tell us a bit about your research and what you and your group have found or studied that has led to, or some possible mechanisms of Zoom fatigue?
Yeah. So first of all, this research is a collaboration between two labs at the Department of Communication at Stanford University. The first one is the Social Media Lab, founded by Professor Hancock, and the other one is the Virtual Human Interaction Lab, founded by Jeremy Billingson. And kind of like you mentioned, like the pandemic hit, and instead of meeting face-to-face between colleagues, we started having all these video conference. And we started working on Zoom fatigue in May 2020, as the members of our research team started to talk about how exhausted they felt participating in so many video conferences. And we started hearing more and more the term of Zoom fatigue in the media, and it was becoming a buzzword. We realized, of course, we got interested because it was something we experience and that we were seeing in the media. But we realized that there was no research on the topic. And so that's why we decided to start studying this new phenomena.
Okay, so with Zoom fatigue, one of the things is we're going through some of the mechanisms that you all were looking at, potential causes, and we're just going to get right into it. This I found this interesting, and it made a lot of the interesting thing about this research you all did. It said, as I thought about it, I'm like, yeah, that makes a lot of sense. Let's talk about large faces. I noticed the people in the SiteCast, you can't see this right now, but Dr. Faville, I don't know if she did this on purpose, but I can actually see a lot of her. She does not have this big face of herself on the screen, even though I'm sure that would be perfectly pleasant. But we all are now looking at each other with these gigantic facial images. And at first you're like, yeah, that's like cool. But then all of a sudden, I mean, I started to notice it too. I am never looking at somebody that close for that long. It's almost, if you think about it, depending on if you're like me right now, you might be on your laptop or your computer or what have you. I mean, you're basically like 3 to 4 inches away from somebody looking at their face. And as I started to think about that, I'm like, whoa, that's not typical. Can you elaborate a little bit more on this large face dynamic?
Yeah, so there are two aspects of this. The faces are large and people seems to be staring at you. So during an in-person meeting, people will stare at you when you're speaking. But when someone else takes over, you're not the center of the attention anymore. You're off the hook. Research has shown that social anxiety of public speaking is very common. So basically, during a video conference, regardless if you are speaking or not, it feels like all the eyes are on you at all time. So you are in this stressful position during the whole time you are on a video conference. So this can be very intense for the brain. And then the second part, and it depends on your computer screen and your settings, but the second part of this intensity has to do with the size of the other participant's face. This large size of the face is the equivalent in real life of someone standing uncomfortably close to you, like if they were invading your personal space. And this kind of physical proximity between two people is perceived by the brain as a situation that will lead to mating or to conflict. So it's a very intense situation for the brain. Actually on my screen, you are a very small face, because one of the thing that we recommend is to minimize as much as possible the size of the video conference window so that I still see you. I can see, if you're smiling, I can see your motions, but I don't have this gigantic face in front of me.
You know, that is, I think about that in terms of those two dimensions. One, this video conferencing and constantly feeling as though you were on the spot. I've given a lot of obviously video conferences and kind of webinars or lectures or grand rounds. And I have to admit the dynamic is actually different, particularly when everybody is there. That makes a lot of sense that people could constantly feel like they're on the spot, because sometimes also when you've got that gallery of folks, you don't know who's looking at you or not, and you feel like you were always on. And if you, for our audience or folks that have social anxiety, particularly around public speaking, that's just got to be a nightmare. Because depending on where you're sitting in the audience, you know that not everyone can see you. Yeah. All right. So if I'm at X, Y, or Z position, in the auditorium, there's only so many people that can see me. But on Zoom, unless you have your screen off, which your video off, which now actually makes a lot of sense, everyone can look at you at any point in time that they want. Oh gosh, how stressful. The next thing is that uncomfortable space that you talked about, and either you want to hug or you want to fight. So that's a very, I combine those things, particularly with those that aren't really comfortable in certain like prolonged public settings. So you've got a bunch of people invading your space and they either want to hug you or potentially it feels like they want to judge it. So that's got to be, I'd imagine our amygdalas are in overdrive at that point in time, depending on where you are and like how comfortable you get. So those dynamics of the large faces. Now let's move to something that I thought was really interesting. It's something, now this I did have to get used to. The constant mirroring. Can you elaborate on what that means? Of course, the constant mirroring.
Yeah, well, so when you are in a video conference with your camera on, you see the image from your own camera. So it's like having a mirror in front of yourself all the time. So can you imagine spending a day of your life with your assistant following you around and, you know, holding a mirror in front of you every time you interact with someone else? That, I mean, that would make anyone like go crazy. And research has shown that seeing your own image, it leads to self-evaluation, which can lead as well to negative effects such as bad mood and anxiety. So it's a very real, you know, concern to have your own image like staring at you the whole time. Luckily, specifically on Zooms this time, you have an option to hide your cell view. So your camera stays on and the other participant can see you, but you don't have this window with your own image.
Okay, I think that's a great point, because I mean, listen, now this is something that I had to get used to with Zoom, seeing myself. Obviously, all of us are used to kind of seeing ourselves, but that constant, at times, unwanted feedback to seeing yourself. And then I think about two different things here in terms of, one, you brought it up, evaluation and judgment. The other thing is, and this becomes very relevant in the field of psychiatry, particularly if you're working with patients or folks, is if you're looking at yourself, or if you're constantly thinking about yourself, you're not thinking about the person in front of you or the patients. And that, I think, is the most distracting things in terms of the attention, because as you said before, you're not used to it. And you start to notice maybe quirks about yourself that you didn't know. I knew that I use my hands a lot when I talk. I didn't realize how much I use them as I spoke. And then also with this mirroring, you can't, not only do you judge yourself, you become a little bit self-conscious in regards to what it is that you do, how the movements are perceived, because again, you're not used to getting that level of feedback per se during it. So during any type of interaction. So yeah, the bottom line is, I mean, we as a social species, I mean, when we interact, we're maybe used to looking at how the other person, we're definitely used to what the other person does and how they reflect back to us, but not like looking at ourselves like that, unless you are an experienced public speaker or an actor or someone of that nature. Now, next point. Okay, so we've got the large faces. Not only do we got large faces, we've got us constantly looking at our own large face. Oh gosh, that just sounds bad. All right, then the next thing, lack of mobility. Talk to us about lack of mobility.
Yeah, so during in-person meeting or phone calls, people have the option to move around. In face-to-face meeting, people will stretch, get up to write something on the whiteboard, go get a drink. And during phone call, you can actually be engaged in other tasks, such as, I don't know, watering your plant or walking around your house, while you are still fully engaged with the phone call. And you know, this mobility, this motion is very important, and researchers have shown that it's very important for learning, for creativity, and for performances in general. Now, during video conference, when the camera is on, there is some kind of expectation that you will stay in the camera view and not, you know, go away and disappear. So you're supposed to be in the view of the camera, supposed to be facing the screen, which decreases the range of motion you can engage in. So you are in some way trapped in the view of the camera.
Mm-hmm. Well, that's an interesting way that you put it in terms of trapped in the view of the camera, because even because I mentioned before that I can talk with my hands and I'm usually moving around a bit, but that movement looks a lot different when you're on screen and when it's magnified, because you could have like kind of a bobblehead effect, like this big head moving around because everything is magnified. The other thing that I like in regards to what you're talking about is terms that trap limiting creativity. So you are so constantly monitoring your own performance and what you do and what you say, and you can't get up and take those natural breaks and pauses. because so I do like that in terms of traps. So because I can't speak for anybody else in the audience. Maybe people can take it how they want. Some folks will get downright upset if you turn off your screen or you get up in the middle of a Zoom meeting. I mean, and that now gets into social pressures in terms of respect, being, collegial, things of that nature. But the pressure of it is so much more intense, because whereas before, even at a big meeting, you're not going to have necessarily this big instant gallery view of everybody. You're going to instantly see what somebody does. Your focus or your attention is going to be on like whoever might be speaking at that time. So I agree with you in regards to the lack of mobility, or better yet, that sense of trappedness. I mean, that focal box can really be a focal box for some. Now, one of my favorite ones here. Did you talk about in terms of mechanisms? Oh, yeah.
Do we want to? Yeah, well, I would love to share some recommendation about how to deal with this, being trapped
Sure.
in the box. Use a standing desk, so that at least you can stretch your legs. You also can increase the distance between you and the camera if you use an external keyboard. So all that gives you a bit more freedom to move around. That's what I'm doing now.
Okay.
I'm spending most of the day when I'm on video conference, and it keeps me much more engaged.
Yeah. All right. Standing. Use a standing desk. I think also, depending on the conference, I think that some people plan in breaks, in terms of when people can stretch. And I think it's important to do that, because we can forget to do that. And I do think I like the idea of standing or doing something or moving. And you look like right now, I mean, you kind of look like you're ready to work out or something like that, which I'm cool with. I'm down with that. So that's a very good point. Now, the next thing in terms of the mechanisms that you all, or things and factors we need to think about: nonverbal communication. How does video conferencing affect nonverbal communication?
Well, so when we are interacting in person, most people have this instinctive understanding of nonverbal behavior, such as your intonation or the orientation of your body. And these are very important cues in conversation. The nonverbal behavior helps us understand what we say, what we want to say without saying it. So it helps us to understand when we can interrupt someone who is speaking without being rude, or it helps us show interest or lack of interest, encourage a speaker to move on without saying it out loud. So with these behavior, we have a way of saying much more than what words can. And during video conference, where you only see the head and the shoulder of the other participant, a lot of the nonverbal communication is lost. So first, during video conference, in order to understand what the other participant means behind the words, you will need to consciously monitor their verbal behavior much more actively than you would do in a face-to-face situation. Then in order to communicate this kind of cues to the other participant, you will have to intensify the cues, for example, by nodding very vigorously or longer than you would if you were in the same room. And research has shown that video conference is more taxing for the brain than audio-only conversation, when you don't need to worry at all about the body language of the other speakers. And in this case, the recommendation would be to turn your camera off if you don't need it. As simple as that.
Okay. Well, that's in terms of the nonverbal behavior. One thing that I always like to think about in terms of nonverbal behavior, if I'm talking to a student, a resident, and also patients, or just anyone in general, 80% of what we communicate is nonverbal. All right. So when I know that I used to, I'm better with it now. I used to really have challenges, particularly when I was coming just starting out, speaking with patients on the phone, because I felt like I lost so much, which I still do. I lost so much of the message. Interestingly enough, video conferencing can give you some elements of that back, but like all things, it's not it's not apples to apples, it's apples to oranges, so to speak, because again, you are getting some, but you're being robbed. You're not getting all of it together. You're only getting part of it. And if you don't know how to process it, and I really liked what you said before in terms of one, being more attentive to the verbal, and then certain ways modifying your own nonverbal behavior cues in terms of the head nods, the voices, the tone, which actually is, I definitely think that's an art, um, to get that social communication going. This is what I think about in terms of just some examples. I think when when people are giving lectures in Zoom, I reflect on how I've had to maybe change my style a little bit in regards to what I give, because I can't rely on the body language of the group, and nor can I actually really work to get a lot of things, out naturally that would come from me just walking around with the audience. The other thing in regards to, if you will, just kind of changes that I think that people need to think about is that not only can you brought this up, Dr. Fabio, not only do you modify, but you also have to be mindful that when you modify it, you can actually go over the top. I mean, for instance, my family has told me, and I hope I'm not doing it on this, is that, Dad, sometimes you're like screaming. And I'm like, I don't know why. I'm just like talking very loud. But I think we have to, but all of that monitoring is stuff that I normally wouldn't do. So that could cost cognitive energy, and that costs cognitive reserves. Now, Dr. Fabio, you've talked with us about in each one of these things, different interventions or things that we can do to minimize Zoom fatigue. Are there any other things or tips or points that you think that the audience can start to think about in regards to minimizing Zoom fatigue?
Well, so the four suspected mechanisms responsible for Zoom fatigue that I talked about were identified by Professor Belenson, who wrote this study that is based on previous research. But for the moment, there is very little research on Zoom fatigue itself. So what people can do is being very mindful of how they use video conference, so that they can themselves reflect on what aspect of video conference is bothering them, and then try to change what's going on. But also organizations can change their culture around video conference to make their employees less fatigued. For example, making it okay to not use your video during the whole duration of the meetings. Being mindful that Zoom fatigue is a thing that people will suffer from, and think about how we can mitigate it.
Okay. All right. Let's maybe go a little bit clinical with this. Let's go ask ourselves some hard questions here, and we'll do it together. Let's ask ourselves some hard questions. Let's say we're working with a patient who is suffering from a clinical unipolar depression, let's say of moderate severity, and typical symptoms, in regards to low energy, maybe lack of motivation, but they're still able to definitely interact. Let's say just on a standard selective serotonin reuptake inhibitor such as sertraline, and they are coming to a clinician and they're saying, you know what? I'm just struggling with these Zoom conferences. And do you have any thoughts or recommendations? What are some things that, I mean, you already kind of went through some of the recommendations, but what are some things that we might think about where we could recommend that some changes our patient with depression, with lower energy, lower motivation, and perhaps if it's an atypical depression, an example, classically increased sensitivity to rejection, what are some things that they could do, we could recommend to them?
So definitely the field of depression is very far from my field, so I won't go there. But we started our research because we thought there is this new kind of fatigue, and we want to address it. But to address it, you need to be able to quantify it, to measure it. So that's why the first step of our research on Zoom fatigue was to design what we call the ZEF scale, Zoom Exhaustion and Fatigue Scale.
Okay.
And so we started in May last year. We ran 5 studies with more than 3,000 participants. And now we have, this ZEF scale, which is a questionnaire that includes 15 questions about how you feel after video conferencing. And all together, these 15 questions measure to what extent you're suffering from Zoom fatigue. But these 15 items account for 5 different types of fatigue. The first one is general fatigue, and we ask questions such as, how tired are you after video conferencing? The second dimension is visual fatigue, with question around how much your eyes hurt after video conferencing. The third one is the emotional fatigue, how emotionally drained you feel after video conference. Fourth, social, to what extent do you avoid social contact? And the last one, the one you were actually talking about, is what we call the motivational fatigue. And we ask to what extent are you too tired to do other things after video conferencing. So with this scale, you can see to what extent you suffer from Zoom fatigue, but you can also go a bit deeper and look into which of the dimension you're suffering from. So is it only visual? Then also knowing which aspect you're suffering from helps you to think about solutions. So if visual, then maybe, check if you need glasses. It's a very different story if it's emotional or social. And having this kind of information for individuals who use video conference a lot is a good start to start reflecting around your own practice.
This is what I'm thinking about. Give me a little bit of rope with this. All right, so we're working with a patient. Again, as I mentioned before, I said clinical unipolar depression. We could just say that an affective spectrum disorder, but I'm also, even though it's going to be different, and I encourage our audience members, send Dr. Faville and I some comments. This is very interesting. All right, but this is how I might start it. First off, you're not alone. You're not alone. This is a common experience. And as a matter of fact, it's been studied. Now, the first way to address a problem is how can we quantify it and measure it? What you may not be aware of is that there are like 5 different types of fatigue that we can think about, particularly with Zoom. So what I would ask you to do is this. Let's actually do this questionnaire, all right? Then let's go over the questionnaire together to figure out what type of fatigue you might be suffering from. And then let's actually, because I'm a CBT guy, let's actually do a bit of a timeline or examine the evidence in regards to where you were at, because we want to make sure that, you were actually having Zoom fatigue and there wasn't something else going on at that particular point in time. Because, we want to address Zoom fatigue with Zoom fatigue solutions, as opposed to, cognitive distortions or minimization or magnification or all or nothing thinking with something else, okay? So, and then based off of that, for instance, I'm just saying, we've got a score, now we've got a baseline, we've customized it. Then, like as an example, general fatigue, I might just throw something out there. Okay, you're having general fatigue. Here's what I want you to do. Let's try a little bit of mobility. Let's see if we can get the body energized, get that whole body cognitive going. Visual fatigue. Let's take a look at the large faces. Okay, I think emotional, social, and motivational, that could be a mix of things. I think that gives you a starting point, as well as the beginning of an evidence-based intervention, how you can talk with your patients. I mean, how does that sound?
Yeah, that sounds like an amazing first step. Another thing that we looked at is how much people use video conference and how it relates to Zoom fatigue. And what we showed in our first study is that the more video conference calls people participating, the longer the video calls are, and the less time you have in between, the more Zoom fatigue people will experience. And also, the more you experience Zoom fatigue, the more negative attitude you have toward video conference. So if your Zoom fatigue is high, check like how many video conferences you have per day. If you have 7 and you have 5 minutes in between, then is there a way to change that, to have less of these calls? Maybe, change one of them for a phone call and walk around your house during that time. That might help.
Okay. All right. Let's go with that. That's huge. All right. Did your research show, like, do we actually have a number? I'm very curious about this, particularly for those of us that are on Zoom conferences or WebEx or whatever all day. is there a number where you're just kind of thinking like, whoa, this is maybe too many in a row or too many overall? I mean, you mentioned the number 7. It could be also obviously durations in regards to this. I'm thinking like maybe half an hour to an hour per typical Zoom call. But did your research show that like there's a certain amount of video time that just kind of can push us over, so to speak?
Yeah. Again, we are very early in this
Right.
research, but for the moment we haven't seen a threshold, like a place you don't want to go any further because it will like increase your chance of experiencing Zoom fatigue tremendously. So we haven't looked at that.
Okay. You know, I would be very, very, very interested in that because in my role, I I was because right now it's recording this. Big shout out to all of the medical students and DO students that are matching because this is match week. You know, so big shout out to all of those students and everybody out there and their families. And you all have worked hard through an amazing, not you've done amazing work through a year like no other. Point
Mhm.
blank. There's no other way to describe it. And my hats are off to you and all everything that you all have done. With that being said, the students at GW, whoo, they are zoomed out. You know, you talk about just because they're constantly on Zoom, and that's even the ones who'd have like a bit of clinical interaction. So I'm really interested on in terms of now I can actually talk about this in terms of institutional wellness.
Mhm.
Maybe there needs to be a bit of a Zoom diet, like where we just kind of say, okay, look, this is enough Zooming. You know what? Maybe we need to go back to a little bit of old school phone conference calling in. And I think I think that some people are naturally doing that. I know that I myself am naturally doing that, but I've never operationalized it. So I find that to be extremely interesting in terms of what we can do. So in addition, so first step, like I did, first step, we scale, we talk, we start to put some things. But in addition to that first step, let's get what is your video conference diet? Let's talk about the duration. And even if you don't have the evidence base, there's going to be a point for each person where they're just like, I'm fed up, or that's it. The other thing I would say is to put something in here, because I started off with it, even though you can talk very easily, no commuter traffic or anything like that, we still have to practice proper work-life balance. I think it's unhealthy to constantly have Zooms at 7 or 8 o'clock at night or over the weekend, even though I'm very guilty of it, but it comes back to bite you. Please, Dr. Favia, what are your thoughts in regards to that?
Yeah, I agree with you that when the pandemic hit, we naturally use video conference because pre-pandemic, that was, the tool we would use when we were not, on site. But as the pandemic unfolded and we experienced this Zoom fatigue, in our research group, we've been much more mindful of the tools we use. Do we really need to have this
Mm.
conversation on video conference? Can we write an email? Can we, take a
Ah,
5-minute phone call so that you are, thinking about the consequences of using a certain tools? And
so it, yeah,
of course, sorry, if you have to share documents and so on, and also like catching up with friends on a more social level, like having the video brings something else. But just think about like if it's not needed and it's going to be a burden and it's going to be tiring, then let's not do that and go back to phone or another communication.
okay. So there is when you talk about that, I really like that because at MDS you talk about asking a hard question. This actually goes back into just kind of stuff. Let's just ask a smart question. Do we need to actually video conference on this one? That can actually cut out a lot. Can I do this via email or phone? And is our institution understanding that? It's not that video conference, there's anything wrong with video conferencing. It's just like anything else, when we overuse it, there's going to be an issue with it or challenges. Now, Dr. Father, another something else. This is a bit of a different slant. How did you get interested in this? How did you come to this work? How did you? I mean, that's. I mean, I'm very curious.
Well, that's an interesting story. So I am trained, first of all, as a marine biologist. Then I got
What?
interested in education, and very interested in how technologies, computer and so on, can be used to help people experience the ocean, that it's often, remote from our everyday life. And after I finished my thesis, my doctorate thesis in Sweden, I had the chance to join Jeremy Bailenson lab at Stanford to study the use of virtual reality for marine education, which was a fantastic journey until March last year, where suddenly we could not have a participant in the lab to put the VR headset on them. So we had to do something else. So we were all like changing the way, the focus of our research. And because we had this new experience of Zoom fatigue, we thought like, wait a minute, what's going on with me and with everyone else? Well, we have this opportunity, this window of time where we cannot do what we usually do. Let's use it to do something different. So that's how I landed in Zoom fatigue.
That is really cool. I mean, so you move from, which actually I have to admit, very fascinating. You move from virtual reality, helping people using virtual reality to help with the education of folks in regards to marine biology or marine life, to Zoom fatigue. That's cool. That's very cool. I mean, now part of me actually wants to I am going to ask it. Why did you want to use technology to help people understand marine biology? I'm just, that's a very interesting, that begs, like, I feel like there's something behind that.
Well, so the ocean covers 70% of the Earth, and it impacts us regardless of where we are and what we do. Even people inland are impacted by the ocean on a daily basis. But when you don't experience something, it's kind of out of sight, out of mind. And even if you live on the coast, you see the surface of the ocean, but 99.99% of the marine environment is not accessible easily. Like you can go scuba diving, but it's a very niche sport. It's costly. It's for a very limited amount of people. And I was wondering, how can we bring the joy that I experience when I am in the ocean to anyone, even if it's virtual? It's better than nothing. So that's why I started to be interested in how different kind of technologies can help bring the ocean to the people. And with virtual reality is almost like not bringing the ocean to the people, but bringing people in the ocean, because when you put the headset on and you look all around you, there is just the ocean all around you. So you feel totally immersed in this virtual water.
Wow, do you think, just out of curiosity, when people, I don't know how many people here have like virtual reality stuff at their house. I mean, I have an Oculus as an example. So do you think that when people change their video experience and maybe experiment with virtual settings, like maybe just taking a dive into the ocean over what VR program that you see fit, do you think that can kind of at times maybe help a little bit with some of this Zoom fatigue, or just kind of the repetition of how we do things with our current video system?
I'm not sure if I experience Zoom fatigue. I'm not sure going in VR is the first thing that I want to do. Like I would rather go outside and take a walk.
Okay. Right, you're reading my mind.
Right, because there is this visual, aspect in Zoom fatigue, and so I'm not certain that adding even more screen time is the answer, at least for me. It definitely brings some, depending on the activity you do, it can, be something very active or very relaxing that can take your mind away from your Zoom fatigue. But personally, I would go outside and take a walk.
Okay. Well, it's interesting that you say that. What I was thinking about is, I think if you can't go out, I think sometimes switching up your dynamic can be useful. But the interesting thing about it, to me, actually, a lot of this makes sense in terms of coming back full circle. One of the biggest things that could probably absolutely help with Zoom fatigue. It's just getting out and walking and participating in your environment. The environment in and of itself is healing. I personally believe that. And again, getting out and walking, swimming, looking at the world in and of itself, I think that you will naturally find, most people will find that their energy resources increase. So with that being said, wow, Dr. Faville, I mean, we went all the way from Zoom fatigue, and now we're outside walking. You've given me this imagery of, and I'm not really a particular swimmer, but you put it in my head now. Now I kind of feel like, you know what? I need to make a point that I can't say I can get to an ocean, but people can get to a lake or a pool or something like that. And I'm going to vary what I do and my experience and reconnect, make sure I'm stay connected with the world and all of its beauty, and not just let Zoom or any type of video conferencing fatigue me. Dr. Faville, it has been a pleasure speaking with you. I think I could talk to you for quite some time, but thank you so very much for appearing on the Sitecast, and any last words on your behalf?
Well, we have our Zeph scale that is available online. So if any of your auditors are interested in taking this survey, it would be amazing if you could have the link on your website.
Okay, we can certainly, I can talk to our editors, we can make that happen. And I personally am very interested in actually using the scale myself. And I would encourage people, let's get this MD Edge community using this. I mean, this is stuff that's applicable wherever you're at. So Dr. Faville, thank you so very much for appearing with us today on the Sitecast to talk about a very, very, very important topic, Zoom fatigue. All right, thank you so much.
Thank you for inviting me.